Now we want to focus on a new COVID strain that's catching the attention of health experts. It's called Arcturus. Joining me now to talk about that is our chief medical contributor, Dr. Ryan Stanton. So thank you so much for being here with us today.
Absolutely.
Yeah, so tell us, how did this latest variant come to be?
Well, this one was actually first noticed back in January and then became a variant of interest to the World Health Organization back on March 22nd. It's one they've just been watching. It's another version of the Omicron strain of the virus. This one does tend to be, as I mentioned, a little bit more contagious than what we've had before. And it does seem to have potentially involvement of a conjunctivitis or some eye involvement. So it looks like a pink eye type presentation with it, but also with the fever and the other symptoms as well. Good news is it's not shown thus far to be any more dangerous than what we've been having so far with the Omicron variant.
Well, you know, we're approaching the summer months when people are getting ready to travel and be around large groups. So, I mean, how concerned should people be about this, and just how serious can it get?
I think the most important thing now, because we have a lot of viruses going around, is really just doing the things that you can do to protect yourself and your family. You know, washing your hands, clean surfaces, staying home if you're sick. Because, you know, what we're seeing now with the virus is, for most people, is a combination of the vaccinations and prior infections does decrease the risk moving forward. And it's still not a huge spike. In fact, right now, worldwide, the numbers are at the lowest point that they've been in a couple of years in terms of deaths from COVID-19. So, and what we're seeing with the evidence is that the risk is actually continuing to drop, especially after the vaccination or infection. So, you know, just do the things to be safe.
Perfect. Is there anything else you'd like to add, or you think people should know?
Still, again, the biggest risk factor is going to be with those that have comorbid medical conditions, the elderly. So being very careful if you're sick, staying around people that may be higher risk. That's one of the biggest things that we're seeing right now, is that potential spread, because people who are sick going into areas where they infect a significant group of people. And with how infectious this is, it's not very difficult to have a significant spread and outbreak. So do everything that you can to help prevent that spread. And if you get symptoms, get tested and take a few days off and rest and start to feel better.
Absolutely. Thank you so much again for being here today. I appreciate it.